2026. It's been 5 years of implementing the NTD roadmap, which was endorsed in the World Health Assembly by the World Health Organization member states. They gave a very clear mandate of what needed to be done in order to address the global burden of these neglected diseases. Between then and the end of the year 2025, the world has changed significantly. There has been a pandemic. The resources required to implement and deliver these interventions have also diminished significantly. A lot of good practices have been used. There have also been innovations that have been created that have enabled us to continue pushing forward through various barriers and challenges. As we are past the halfway point and can see the end of the roadmap at 2030, we need to understand what is it we can use, adopt to accelerate progress towards reaching those goals, to further promote mainstreaming of these interventions into existing national systems, and more importantly, to enable member states, the countries themselves, to own these programs in a manner that is sustainable and can continue to reach the intended beneficiaries who have suffered a great deal from the debilitating effects of morbidity and death that result from neglected tropical diseases.
The monitoring of the WHO Neglected Tropical Disease or NTD roadmap includes both qualitative and quantitative assessment. The quantitative assessment relies primarily on numerical information that is routinely collected by the countries, and then it's compiled by the WHO and reported by disease. On the other hand, the qualitative assessment relies on information provided by the program managers, by disease experts, and other healthcare providers to identify the gaps that hinder progress. For that, we have developed a standard process that is called the Gap Assessment Tool, or GATT for short. And the GATT covers all the NTDs across 11 topics or dimensions, as we call them. This GATT standard process starts with a global survey of all the stakeholder community, and then is followed by focal group discussions that involve the program managers, the disease experts, WHO staff, and other stakeholders as relevant. And all this process is overseen by the GATT Steering Committee that is part of the WHO Working Group on Monitoring and Evaluation for NTDs. The GATT results are presented in a heat map that includes all the disease across all the 11 dimensions. But most importantly, the results also include the priority actions and key cross-cutting activities that are needed to improve the health outcomes. In summary, what the GATT does is it complements the quantitative assessment by providing the how and the why the MTD programs are where they are. So the GATT identifies effective and cost-efficient actions that target the gaps and can accelerate the progress.
At this first stage, we analyze 4 of the 11 dimensions that are included in the NTDs roadmap. Our organization, Unlimit Health, led this consultation with WHO, published an initial set of results in Plus NTDs in July 2025. More recently, the community can observe these results as well on the most recent global report on NTDs. These 3 key messages stand out from this work. First is that substantive work remains to be done to ensure that NTD programs have the necessary resources to conduct their operations comprehensively, not only in terms of interventions like preventive chemotherapy campaigns, but also the provision of complementary services such as mental health support or rehabilitation services. In addition, secondly, There is evidence that there has been substantive progress in the development of programmatic and technical guidance, particularly around the areas of monitoring, evaluation, and diagnostics. We hope that in the future, with adequate resources, those green shoots can lead to significant positive change. And thirdly, now more than ever, there is a clear need for the development of cross-cutting initiatives, not only enhancing the collaboration between NTD programs, but also ensuring that these programs can reach out to other sectors, such as agriculture, education, or WASH. This not only will enable our operations to be more cost-effective and access more resources, but also help us to address broader challenges, such as climate change and One Health. It helps the community to discuss and to reflect on what has been achieved to date, and to what extent they consider that the operations conducted to this stage, to this moment, are sufficient to achieve our 2030 targets. It can help to build consensus and motivate stakeholders to agree on an agenda to push forward for 2030. In the coming months, we're going to have group discussions with multiple stakeholders to discuss the remaining 7 dimensions, which include topics such as the scientific understanding of the NTDs we are tackling. We will start doing data collection in the coming months, and hopefully we will complete this process by the end of the year.